be anesthetized. For doing the sciatic nerve block, you need to inject an anesthetic fluid into the sciatic nerve area. So, how do you identify this area? You need to connect the posterior superior iliac spine and the apex of the greater trochanter, and put a midpoint on this line and go slightly inferomedial to this point, and this is the point where you need to give the anesthetic fluid injection. So, that will result in anesthesia of the lower limb, especially below the knee. Next condition is piriformis syndrome. It is an entrapment neuropathy. You find sciatic nerve as it emerges out of the pelvic cavity through the greater sciatic notch lies usually below piriformis, and if this piriformis muscle is enlarged, as seen in case of athletes, especially in lady athletes, it can compress the sciatic nerve as it comes out, resulting in piriformis syndrome, and the patient will have pain in the buttock area. Penetrating wounds on the back can also injure sciatic nerve, especially in the area where sciatic nerve is got a subfacial course, that is between the gluteus maximus and the long head of biceps femoris. Between these two superficial muscles, sciatic nerve has got a subfacial course. So, any penetrating wounds in this area can easily injure sciatic nerve. Lastly, posterior dislocation of the hip joint. You find the hip joint with the obturator externus deep to the quadratus femoris is a posterior relation of the sciatic nerve. So, if this hip joint dislocates posteriorly, it will be stretching the sciatic nerve, resulting in injury to sciatic nerve. Any injury to sciatic nerve will or its terminal branches, that is the common peroneal nerve, can result in a condition called as foot drop. As you can see, the right foot is plantar flexed. So, a person when he has lifted the foot off the ground, it will be plantar flexed hanging down, whereas the left foot is normal. So, foot drop is a condition you find in injury to the deep peroneal nerve or the sciatic nerve. Deep peroneal nerve is going to supply the muscles of the anterior compartment which act as dorsiflexors. So, if there is no dorsiflexion, it results in foot drop. Coming to the summary of sciatic nerve, we looked at sciatic nerve origin, and it is a branch of sacral plexus, it is a terminal branch coming out through the greater sciatic notch below the piriformis. It supplies the hip joint and the hamstring group of muscles which are present on the back of the thigh, terminates at the superior angle of the popliteal fossa. It supplies all muscles below knee, and so if there is an injury to the sciatic nerve, all the muscles below knee will be paralyzed. It supplies most of the skin of the leg and foot through its terminal branches, except for a small area along the medial side of the leg and the foot up to the ball of the great toe, supplied by the saphenous nerve, which is a branch coming from the femoral nerve. So, whole of the leg and the foot except for this medial area has loss of sensation or has anesthesia. Sciatica is a condition caused by compression of sciatic nerve root fibers, resulting in pain radiating from the back of thigh to the lower part of the leg along the course of deep peroneal nerve. There can be associated symptoms like loss of sensation if it becomes a chronic condition. Intramuscular injection should be given in the upper lateral quadrant, otherwise it can cause injury to sciatic nerve. Injury to sciatic nerve, one of the commonest causes is iatrogenic, that is the induced injury by the paramedical or the medical staff, and this is usually due to intramuscular injection wrongly placed on the maximum convex surface of the gluteal region. that should never be done. It should be given to the upper quadrant of the gluteal region. So, upper lateral quadrant is the preferred site where you will be injecting into the gluteus medius. So, these are the points which should be kept in mind for sciatic nerve. Thank you.
Swayam Prabha, Digital India, Educated India.
Today we will look at what is pathology, and we will address this topic, first attempting a definition of pathology. Then we will be looking at what goes into the making of pathology, that is, we will look at the sub divisions of pathology. We will also look at the important terms that we commonly use in pathology. So, these are the three areas we are going to look at, and let us start off with the first, that is the definition. What do we understand by the word pathology? Pathology comes from pathos, that is suffering. When one is not at ease, he or she has a disease, and the study of disease is pathology. So, logos means study of and pathos means disease. So, the study of suffering, the study of disease, when one is not at ease, that is disease, and that is what we study. Now, this is a very broad definition, but more specifically when we look at pathology, it is a scientific approach to the study of disease. And what does that mean? Scientific approach means what? It means structural changes. What structural changes can happen in organs when it is diseased? When organs are diseased, what are those structural changes that happen? So, that is part of pathology, and a large part of pathology will be looking at those changes that happen in the anatomy and the physiology. That is, the anatomy gone wrong, the physiology gone wrong is pathology. So, when we look at structural changes, we are looking at changes that have become so abnormal that it is recognizable as something pathological. So, structural changes are studied in pathology. We also look at functional changes. This is what I said, physiology going wrong. So, when the function becomes dysfunction, then that is pathology. So, anatomy going wrong, structural changes; physiology going wrong, functional changes. Investigations. An integral part of a pathologist's functioning is investigation. You investigate and find out what is wrong, so that you provide the final diagnosis. I will be talking about that in a moment. So, investigations